Hi there, welcome to National Fertility Awareness Week 2025. We are today going to explore the cutting edge of fertility, the science and the regulation. My name's Sharon Martin and I'm your host today. And today I'm delighted to be joined by Claire Ettinghausen, Director of Strategy and Corporate Affairs at the HFEA, full title being Human Fertilisation and Embryology Authority. Claire brings a wealth of experience from across the public sector and has been leading on the HFEA's work in patient experience, policy development, clinical oversight since joining them in 2018. So, without much further ado, Claire, welcome and thank you for joining us. I have spoken to patients, we have out and asked them what is the questions you would want to know of the HFEA. So if you don't mind, I've got a list of questions that I'd love to hear the answers, and I'm sure all of our patients would love to hear those answers. So welcome, Claire.
Thanks, and thanks very much for Fertility Network for hosting this. It's always a good opportunity to be able to speak about the HFEA and tell patients and anyone else listening or watching what it is that we actually do.
So for those that may not know, what exactly does the HFEA do, and how does it impact a patient undergoing fertility treatment?
Yeah, it's a really good question because, you know, in our day-to-day lives, lots of regulators exist. We hear about them sometimes from the news, but we don't often have that much day-to-day interaction with them. And in fertility treatment, some of the information we provide can affect people's fertility treatment on a day-to-day basis. So the HFEA, as you said, the Human Fertilisation and Embryology Authority, was set up in 1991 when fertility treatment was still quite new. And we're the UK-wide regulator of all fertility treatment and human embryo research. So anyone stepping into a licensed HFEA clinic, whether it's NHS or they're paying for treatment themselves, whether they live in Scotland, Wales, England and Northern Ireland, anyone stepping into that clinic can be assured that a clinic has met the standards and the legal requirements that the HFEA is required by law to ensure are carried out. So we inspect and license all fertility clinics. We set standards according to the law and our guidance, and we also publish information to support both fertility patients and clinic staff and researchers using a wealth of information that's on the HFEA website, and also you can see through our various social media channels.
Okay, thank you. So that brings me nicely on. What powers does the HFEA actually have in relation to, a fertility journey?
Yeah. So the powers that we have mostly date back to 1991, so that's quite a long time ago, but they're still relevant today despite us wanting to see some improvements. So the powers we have really relate to what a clinic does on a day-to-day basis. So by law, no fertility treatment can take place without a license from the HFEA. So I can't just go and set up a clinic tomorrow at, building at the end of my road and start fertility treatment. You have to have a license from the HFEA. That means you have to pass certain standards, you have to have the right number or an appropriate number of trained staff. And there are lots of parts of our law, our legislation, that if a clinic is not keeping to, is actually a criminal offence. It's against the law to do these things. So our job as the regulator is to make sure that any clinic offering treatment is doing it in line with the law. And we issue licenses to clinics to be able to carry out that treatment. If those conditions that are placed on a license are not respected or are broken, we can take away the license. We can suspend it. We can say to a clinic, we're really concerned about what's taking place here. We don't want you to see any patients for a certain period of time until you've demonstrated that you can improve things. And we can also do something called putting conditions on a license. So if we have a concern about a particular aspect of treatment, we can say, okay, you can still carry on treating these groups of patients, but these groups, we're really concerned, and until things change, you can't do that. As I say, all clinics are inspected every 2 years by our inspectors who are really well qualified. They are the clinical inspectors. A lot of them are ex-midwives or nurses, have real experience of healthcare settings, and others are scientists, and they look at different aspects, whether it's the patient journey or the laboratory. And based on their specific areas of expertise, they see if there are any areas of improvement that need to be made. Those are then reviewed by the clinic to try and make improvements. So really our powers are very much kind of on the ground, what's happening on a day-to-day basis, and to ensure that that safety standard is met for patients.
Okay, that's really interesting. That brings me on to, you said a lot of the, or all of the laws were set up in 1991. So how does the HFEA adapt with new and emerging technologies coming in? Do you know, how does that impact patients?
Yes, I think from a patient or a public's perspective, it feels, almost every kind of month or two, you see something on the news that says, this is the next big thing. This is going to, change the world of fertility treatment. And I'd say that, we should always be a bit cautious about the next big thing. Sometimes you look at those studies and, it's sort of, it hasn't really been proved that it actually works in humans. Sometimes they're quite small numbers of people involved. So I think we always have to be a bit cautious. What we do at the HFEA, we've got a particular committee that looks at scientific developments. That's made up of different people, expertise, people who have experience doing embryo research, people who've experienced as doctors, as embryologists, as urologists, a whole range of experience. And they meet 3 times a year, and they look at kind of what is these new big things coming up. Would they work in a clinic, or is this just a research thing? And if they would work in a clinic, what does the HFEA have to think about from both an ethical perspective, and that's a really important part of our work, as well as a regulatory perspective. So I think we're really always trying to look both nationally and internationally at what those innovations are. They do, though, however kind of attractive they look, they can take a long time before they're actually something that is available to patients. And it can take years and years in some cases.
Yeah, so that brings us on nicely to, one of the things that, we often Fertility Network is, signpost our beneficiaries to the HFEA's website, particularly the traffic light system, because there is new emerging technologies. Of course there is. Science never stands still. But we've got all of these add-ons now. So can you explain about the traffic light system and how that will actually help a patient make, a more informed decision towards their own treatment path?
Absolutely. So unlike, for example, if you were having a hip replacement, wherever you had a hip replacement, I imagine the kind of, the options for your treatment choices would be fairly similar. I think what fertility patients are faced with when they go to a clinic, particularly for the 75% of people who are paying for their own treatment, who are self-funded, is almost a menu of options. And it's really difficult, especially if you've not had fertility treatment before, or you don't know anyone who does, what does this all mean? And I think sometimes it's really hard to say, but sometimes you can see something and you think this sounds too good to be true. And I guess what we've tried to do through our add-ons information is to say, well, maybe it is too good to be true. So add-ons are what we call optional extras beyond standard treatment. They're often charged for, although not always. And they're things that they may help some people, but generally for the whole patient population, they won't make a difference to the chances of having a baby, which is obviously why anyone is having fertility treatment. We've done a lot of work through our scientific committee in looking at the scientific evidence for these add-ons. So do they in fact help most people, increase the success rate, the likelihood of having a baby? And what about other outcomes? Are there particular patient groups, so for kind of older patients or patients who are at kind of risk of particular things happening during their medical treatment, or for people who've perhaps suffered many miscarriages before, which sadly many people do? Are there different groups where some of these add-ons may be beneficial? We've put all that information together and have what we call a traffic light system, although it now has 5 different colors rather than 3, saying based on all the scientific evidence we've looked at around the world, the best evidence says, and for each of those add-ons, and some people may have heard of some of those, there's some things called embryo glue or endometrial scratch, or even PGTA, which often gets some publicity. We've rated those about whether there is enough evidence to say that it improves success rates for particular patient groups, for all patient groups, whether there's no evidence yet, so there just hasn't been enough research. And in some cases, the research says actually having this add-on could be quite dangerous, and in fact could negatively affect your treatment. So I'd encourage anyone, again, clinics really should be signposting to our website, but anyone who's going into treatment and is sort of suggested any of these additional treatments, have a look on the HFEA add-on information. I know we've also got questions that you can take to your clinic about add-ons, or you can always email them afterwards. Things like, why am I being offered this add-on? How will it help me? Is it a good use of my money? And we generally find that, given that fertility treatment can be very expensive for those majority of people who don't have NHS funding, that the likelihood is that better to save your money towards a future cycle of treatment than go for a kind of shopping list of add-ons. But it should be said that these are conversations to be having with a clinician who will be the only people, the medical staff in the clinic will be the only people who know your particular medical circumstances. And the evidence, if we go through the add-on evidence, there are circumstances where for some patient groups an add-on may indeed be helpful, but we're looking at patient groups as a whole. But all that information is on the HFEA website, and you can kind of use it really to talk to your clinic about any add-ons you might be offered.
That's really helpful advice, Claire, and I would recommend to all patients prior to starting any treatment is to make themselves aware of potential add-ons, and at the point you've been offered it by the clinician, then you'll be able to say, why are they suggesting this for you? Because on the HFEA website it says X, Y, or Z. Okay, thank you. Moving on. How do you ensure, Claire, as a regulator, that UK clinics maintain a consistent standard of care for all patients?
Yeah, I mean, I think that's a really good question, because I suppose there's several aspects to standards of care. There's the kind of, what minimal, if you like, health, safety, regulations, what happens in the lab. And then there's kind of how you as a patient, how we feel about the service, which kind of goes beyond, health and safety. And, what I feel is appropriate may be different to someone else's. So we look at all those aspects on inspection. So the law, as I said, is set out, kind of dates back to 1990. We've got a code of practice, which is the kind of, if you like, the Bible for clinics that sets out how they need to apply the law. And then when inspectors go in, they look at all those different aspects, both of kind of, the building, the staff, what happens are in the consent process with patients, what happens after treatment. Also, inspectors look at the feedback that we get from patients. So there's an opportunity on our website. If you look at the Choose a Fertility Clinic function, if you've had treatment at a UK clinic, you can provide feedback, and the inspectors always review that before the inspection, and they take on board any of the comments and raise them with clinics. So we have the same standard that we're applying to all the UK clinics. As I said at the start, NHS or private, wherever they are in the UK, the same standards are applied. We publish all that information, so before you go to a clinic, you can have a look on that Choose a Fertility Clinic part of our website. You can even look at the most recent inspection report. It's not written in the most kind of patient-friendly way. It's really written with the clinic to say if there are any improvements, what they need to do. But certainly, people do read them, and they really have a think about some of the things that's said in there. And I guess that's why I think in any healthcare setting, it's really down to individual experience. So, what my neighbour or friend may really like from one clinic may not be the same as, my other friend or neighbour may prefer something different. So some people like things that are very sort of small and personal and individualised. Other people prefer a kind of, much bigger setting where, sort of a busier feel. And that's a very personal decision. we know from our patient surveys that the location of the clinic plays the biggest factor in kind of why people are choosing a clinic. And obviously that makes sense because you want somewhere that's convenient to get to, whether it's kind of your home or where you work. But I suppose it's providing that reassurance really to patients that whichever clinic they step into, the same standards must be met wherever they are in the UK.
Okay, thank you. Another really big factor for patients is around individual clinic success rates. Now, I know that the HFEA publishes that data on their website. Do you want to just touch on that data that you've got on the HFEA website?
Yeah, so by law, every clinic must provide information about every treatment and outcome, whether it ended up in a birth of a baby or not, must provide that information to us. We've collected that data since we were set up since 1991. So we've got the longest running register of fertility treatment and outcomes in the world. That's really valuable for researchers for looking at, for example, if there are any long-term impacts of fertility treatment, any impacts on the patients involved or any of the babies born. It's a really kind of very rich data set. What we do is we publish 2 or 3 different types of information. We have information on kind of the national level. So out of all UK treatments, what was the birth rate? How many treatments took place with different family types? So with heterosexual or opposite sex couples, with same-sex couples, with single patients, what types of treatments? So fresh treatments, frozen treatments, egg freezing, etc. And we published all of that on what we call a dashboard, which is on our website. And people can have a look at that, play around. It has lots of different bits of information, including information on funding trends and information broken down both by age, ethnicity and family type. On the Choose a Fertility Clinic part of our website, we publish information for each clinic on their success rate. So given the number of cycles of treatment they performed, how many ended up in a successful outcome. We've just in the process, we've done a big piece of work over many years to update our register, and we're getting to the end of that at the end of 2025. So most clinics have got some updated information now on their web pages, and then we'll go back and provide even more of that updated information towards the end of 2025. And some people may have recently seen we did a consultation exercise on kind of which of those headline figures people would most like to see, whether they're a patient or a member of clinical staff. And we're just kind of looking through all that information now. And it is really complicated. I mean, looking at, what's done in different countries, Australia or America, there's lots of different ways you can show those success rates. None of them are the best or the most perfect way. And I guess what I always say to someone is it's an indication of success rates for other people in your age range or in your treatment type, but it shouldn't be used as a predictive model. The only person who can kind of talk to you about your own likelihood of success, which will depend on a whole lot of medical factors and previous medical experience, will be your clinician. So anyone looking at clinics and looking at success rates should know that there's a really kind of small difference between clinics, and that these are kind of grouped together by several different age bands. And it's really important to take that and then discuss with your own clinic about what that means for your own likely success.
One of the issues that our patients have brought to us is just the difference between what the HFEA success rate says for that clinic and what that patient has been told by their clinic or seen on that clinic's website. Is there a disparity between what the HFEA are saying and what the clinics are saying? And do the HFEA have a standard in terms of how that should be communicated to the patient?
So we do have a standard that it should be communicated clearly. The headline figure at the moment is births per embryo transferred, and that should be the figure that clinics use. They should also be very transparent about what they're saying in terms of the numbers of patients, or whether it's clinics sometimes have a particular group of patients that they work with, so maybe younger patients or older patients, or predominantly people using donor eggs, etc. And they should be very transparent about that. I mean, I have to say, sometimes we find we look at clinic websites, and by clever use of color sometimes, or different diagrams, sometimes it can be quite hard to sort of read between the lines of those success rates. So I'd always say that the HFEA website is the only place where you can have the verified data that compares, you're comparing like with like between one clinic and the other. I'd say for anyone who's looking at a clinic website where the success rates vary very widely from the HFEA website, again, it's unfortunate that it's sort of the patient that needs to ask the question, but perhaps ask a bit more kind of, what's involved, what are the patient numbers, and, just double check does it sort of involve patients like me in my situation, or is it really numbers that are relating to a different patient group or age range?
Okay, thank you. And does the HFEA publish the data against different, outcome groups, LGBTQ plus, ethnic minorities, or is it all put together?
So the two different types of information have different outcomes in them. So the HFEA dashboard, which has the whole UK-wide figures, has got that information by ethnic group, by family type. Even you can look at different parts of the UK and English nation. For the clinic information, that is published mostly by age range and different treatment types. So for example, if you had treatment with donor eggs, or a fresh cycle or a frozen cycle, mainly because in a clinic level, sometimes numbers might be too small to be able to kind of publish that in a meaningful way. I should say, once we get back up to having the most up-to-date information in Choose a Fertility Clinic, which will happen by the end of this calendar year, one of the things we'd really like to do over the next couple of years is have a look at, we've got lots of different bits of data on our website, and really have a look about how we can have an overhaul of that and make it much more meaningful, so that, for example, you can do more drilling down and search by ethnicity, or by family type, or by treatment type on a clinic level basis. So we're sort of just trying to get back up to having the most current information, and then we're going to have a look at how we can perhaps modernize or update that information.
Okay, thank you. So one of the things that's raised with us is people, on a fertility journey have been to a clinic, and they feel, that journey has not met their expectations. Some even go as far as to say they felt misled or mistreated by that clinic. What rights do the patient have, and who can they complain to?
Yes, I mean, it's complex between which aspects of their treatment they're concerned about. I mean, firstly, I should say, we want anyone coming out of a clinic, whatever their outcome of their fertility treatment, to feel that they've had a positive interaction with that service. And it's always upsetting and distressing to hear people being dissatisfied for whatever reason. The HFEA has no powers over the cost of treatment, whether that's in the NHS or private clinics. So we do, get people who are concerned that they thought they were going to pay one thing and they were paying another, and that's really hard for us because we have very limited powers in that area. It should be said that a few years ago, the Competition and Markets Authority, who their job is to make sure that consumer law is respected by everyone who's a business, including fertility clinics, and they did some work, including having some videos for patients and some leaflets that are available on our website about the information to be provided to people before they start treatment. And their view was, if I go and sort of buy a mobile phone, I have a lot of information before I decide to sign on the dotted line, and it should be the same with any aspect of fertility treatment. That being said, there's some information on the HFEA website about if you're unhappy with any of the information or the treatment you've had from a clinic. We have to recommend that people go through the clinic's complaints process first, and after that they can raise a complaint with us. And if people go on the HFEA website, there's a sort of a whole web page that explains how to raise a complaint. And we do get involved on a frequent basis to support kind of patients in clinics to get to a solution or a resolution that everyone is content with.
Okay, thank you. So, as you know, and it's been borne out in the HFEA surveys and data, fertility treatment is becoming more available and more people are accessing. I'm thinking of single people, LGBTQ plus, and the creation of more diverse families. What is the HFEA doing, to support people on a fertility pathway?
Yeah, I mean, we've certainly seen, particularly over the last 10 years, the makeup of the change in who's having fertility treatments becoming more and more stark. So, still the large majority of people having treatment are those in opposite sex or heterosexual couples. The fastest growing treatment tends to be single patients who are freezing their eggs for kind of reproductive choice reasons. We've also seen a really huge increase in the number of female same-sex couples and single patients having IVF particularly. What we know from our data is that those are the groups who are least likely to have any NHS funding, particularly slightly more funding, but not that much in Scotland. And in England and Wales and Northern Ireland, there's almost no funding for female same-sex couples and single patients. And as I said, although we don't have any responsibility over funding, one of our key strategic objectives is to try and call for greater equality of access to groups, whether it is for groups from different family types or single patients, or indeed we see Black and Asian patients in many circumstances having lower success rates than white patients, predominantly because they're accessing treatment in older age groups. So we absolutely are using that data that I talked about that we collect to highlight these inequalities and to really try and ensure if there is any changes in funding that these groups are not left out, these family types are not left out. At the same time, we've had some small kind of successes. So the law has been changed to enable female same-sex couples who are embarking in reciprocal IVF or shared motherhood circumstances to be on a more equal footing with those in an opposite sex relationship. So there's been some small kind of successes over the way, but that's not to say, particularly in the funding side, there's more to go.
Thank you. And coming on to communication, what could be done to make fertility information and treatment accessible to everyone, not just those, as you mentioned earlier, 75% of the cycles in the UK are privately funded. What could, in the UK and society and governments could we do to widen that access?
Yeah, I mean, I think it's really hard to know. If only I was in charge of commissioning, for NHS funding. I think we all understand there's a limited amount of money, available in the NHS, but the allocation, it does seem really unfair. It largely depends where you live, particularly in England. You could be living on one side of the road, and if your postcode is different from someone on the opposite side of the road, you could have access to different amounts of funding, which makes a real difference. I mean, I think we particularly in our response to sort of government consultations, we've particularly emphasised how a GP in primary care in general can be both an enabler to treatment or a blocker. So we have, some people feedback they've had such positive experiences with their GP, and that's kind of helped them to get, if they have had fertility treatment, it's helped them to get early access to treatment. And the earlier people access, the younger people access treatment, generally the more chances of success. In other circumstances, people sadly feel that kind of they've had a GP who hasn't really kind of appreciated their situation. Perhaps it's taken them much longer to access specialist services, and they might have even fallen outside of the age range where if they even had access to NHS funding, they've kind of now accessed older. So it's really a whole system change that we want to enable people to access treatment as early and as quickly as possible. And that would be also the best use of NHS funding that is possible.
Yeah, and it's something that here at Fertility Network we're absolutely passionate about, is trying to, reach people quicker so that, by the time that we're engaging with them. You know, they're not falling outside of the NHS funding criteria.
Exactly. Yeah.
Particularly, you know, BMI is a huge issue in our patient groups. And, you know, if you're in your late 30s, you didn't know there was a BMI criteria attached to, you know, NHS funding, that might have been something you worked on years before. Thank you. So if there's one thing you could change about the fertility regulation in the UK, what would it be?
Well, I think you've just touched on kind of several aspects that are frustrating, you know, the kind of so-called postcode lottery and some of the inequalities we see. You know, and I think that's really frustrating. That's not necessarily a kind of regulatory issue, but it's frustrating for all of us working in the fertility sector. I suppose if I could change one thing about our kind of regulation, it would be to, you know, update our powers. They're very sort of they are out of date. When we were set up in our powers, you know, we were set up by law in 1990 and we started working in 1991. You know, the world has changed since then. In 1991, most people went to, you know, a fertility clinic that was a building. Their whole patient journey was in the same building. Now we see that there's apps and websites and online services. Some of those might not even be UK based, and you know, those are all designed to make our lives easier as, you know, as patients. And we've all got, you know, busy lives and working lives, and that's great that we can access some things on our phones, or we can go to somewhere that's not perhaps our fertility clinic, that's another medical facility for our scans, and only go to the fertility clinic for you know, embryo transfer. But I suppose as all those different things have grown, it means that we are slightly stuck in the kind of old-fashioned area, and that's what's hard for us, is that we're sort of trying to fit kind of, you know, old-fashioned sort of powers and responsibilities into kind of a new digital age. And that's you know, it's quite hard. We're sort of trying to fit these all and trying to change, and sometimes we just hit a brick wall that just says, you know, there's nothing we can do about that, because, you know, it's not set out in the law that dates back to 1990.
So if there was something that would support patients, is there anything that you wish patients knew or understood before they even started their fertility treatment with their clinic?
Oh, well, that's a really good question. I mean, I suppose that sometimes it's frustrating when you see kind of on TV programs in the media, kind of, it's almost like, oh, well, I'll turn to IVF and, you know, it will be fine. And I
Mhm.
wouldn't want anyone starting fertility treatment to go in without kind of, you know, hope and expectation. But sometimes, you know, it feels that people's expectations based on kind of what you see in the media is kind of not the reality. At the same time, you know, different people need different things. So finding kind of the level of support for someone starting out on their fertility journey, whether it's from, you know, support groups that Fertility Network or others might run, or something, you know, there are walking groups and running groups and book groups. There's counselling support and others. So I think just really thinking about when you start that process, when you start the process with a clinic, you know, how keep some grounding and find the type of support that is suitable for you. What might be right for someone else is not necessarily right for you as an individual.
Thank you, Claire. And just a couple more questions. This one's for you. How do you personally stay grounded in this role when you're dealing with such emotional and ethical issues every day?
And I think that's a really good question. I suppose, you know, I think it's probably correct to say that everyone at the HFEA feels absolutely privileged in what we do. You know, we work with such, you know, amazing people, whether it's kind of patients who are sort of have such hope for their future, the clinic staff who, you know, on the whole take such care and are so passionate about what they do and how they are helping patients, or some of the scientists, you know, where we started the conversation looking at what's coming down the future. In the future, you know, I think all of us feel absolutely privileged to work with all these people. I suppose hoping that we can make a small bit of difference to someone's life, whether it's a patient or a member of clinic staff, you know, on a day-to-day basis. That's what kind of keeps us excited. And you know, there is not a day or a week where there's not a new challenge of you know, a patient being in a difficult situation that, you know, you think all of this time since 1991 we should have come across, but we haven't. A member of clinic staff who's dealing with a particular challenge, or, you know, a question from a journalist about, you know, something that they've seen or read. So I think the challenges are immense, but I think we're all, you know, really proud that the UK is considered to be the leader in both fertility treatment and fertility treatment regulation. We have people from all around the world who want to model their systems on what, you know, we were set up to do since 1991. So, you know, I suppose I really kind of feel very lucky that I'm in a job that gives me such you know, a sense of joy that in what I do, but also, you know, I work across the board with people at the HFEA, and then, you know, people like you, Sharon, and others who are working on patient support, where there isn't one person who's not passionate about making a difference to people's lives.
Yeah, and I think it should be really comforting for anyone embarking or are currently on a fertility journey that we've actually got the HFEA in the UK, because, you know, there's so many patients travelling overseas now, mainly due to costs for treatment, but not all countries have a regulator the way that we've got in the UK, with such transparent information. So my advice to anyone that's embarking on fertility treatment, make sure you see, you know, in the UK, you find they're all covered by the HFEA, but if you're going to use a clinic abroad, then check what checks and balances that clinic's got. You know, they might be advertising amazing success rates, but who's actually doing the checks and balances on those success rates? And finally,
Absolutely.
do you have a hope for the future in fertility care in the UK?
I think the hope for the future is that that we continue to see progress. So I think there is great, you know, if we think back to, you know, the world's first IVF baby, you know, it's not even 50 yet. We think about the, you know, the changes that have happened over the last nearly 50 years. I think that gives us great hope for the future, that we are in a good place in the UK in terms of improving success rates, improving access as far as we can. And I think that we all will see that continue to grow. So different types of families and single patients being able to access fertility treatment, and hopefully with an increase in success rates over time, you know, more and more people will go home with that much longed for baby.
Okay, thank you, Claire, for taking the time and opening up National Fertility Awareness Week. Thank you.
Thank you.